Hi, I'm Dr. Kelly Starrett from the Ready State. One of the things we're always trying to do is see if we can apply principles to unique situations. And one of the best applications of principles here is to say, can I use H-wave on my hands when I have cuts, when I have arthritis, when my hands are swollen and I have to use my hands for my job or activity? Now, the problem with the hands is that they're in constant motion and constantly interacting with our environments. And oftentimes when we get a cut, we have some trauma, we get swelling. There's twofold issues that we want to address. One is that the hands are always down by the side, and that means that they're sort of always at the bottom of a gravity well. And it's difficult for me to walk around with my hands up trying to decongest them if I've got some swelling or a lot of use. I'm thinking about my climbers, carpenters, people who are working with their hands every single day. The second thing is I have a lot of these little bands of tissue called retinaculum. And these bands of tissue keep, at the wrist, at every knuckle, they keep my tendons from bowstringing. And if I didn't have these knuckle sort of bands of tissue, when I flex my fingers, it would go from the tip of my finger down to my elbow. It would just kind of bowstring out. And that clearly wouldn't work very well. But every one of those sort of bands ends up being like a little hairband, potentially trapping swelling, trapping congestion in the limb. Add to the fact that there's just not a lot of big musculature in the hand. And so what ends up oftentimes happening is when we have some swelling, we've got a little infection, we've got a cut, or I'm using my hands day after day, and they fall behind. So the application of the H-wave in this situation is pretty profound because I can be pumping my forearms, which is going to draw that swelling out. I'm gonna get a ton of muscle contraction. I don't even have to pump my hands. Getting a muscle contraction in the hand would be great on the palm, but even just getting pumping on the forearms using the low frequency setting for 20 minutes, 30 minutes, could I get an hour? Could I fall asleep with it on? And oftentimes what we find is that what we find every time is that after we get a lot of non-fatiguing muscle contraction, we can greatly reduce the amount of swelling and congestion in the hands. And one of the things that happens as a byproduct of removing congestion is oftentimes that reduces sensitivity. So it's the swelling that's actually causing the pain, the congestion's causing the pain. And when I remove that, I suddenly feel like I can move more. And if I move more, then I'm going to do more congestion. I'm going to bring the groceries in and take the garbage out. Which brings us to the second point, is that oftentimes when I'm congested, that congestion rate limits my body's ability to heal. And that means when I heal, not necessarily from trauma, but heal as in, hey, I've been using my hands a ton, and now they're swollen. And part of that sort of rebuilding, repatriation of the tissues is that I've got to remove that congestion to bring the blood flow in. So by creating that non-fatiguing muscle contraction, I'm going to enhance blood flow to these areas, which need it. And I'm going to remove that congestion, even if my hands are at the bottom of a gravity well, or I've got all these retinaculum, it's not going to matter. So when you know someone who's using their hands and they complain about being sore at the end of the day, certainly a hand massage will make friends, but don't be afraid to grab your old trusty H-wave and apply it to this use case. If you're using your hands a lot and they feel stiff, go ahead and pump them out and you'll be right as rain.